Good afternoon and welcome to this live talk show. You are watching NTV Uganda and I am Rita Kanya. Now this afternoon we're going to be talking about a blessing that God has given, and those are children. But unfortunately during this COVID-19 pandemic and even before, although the cases are increasing, they have been present within our country, and that is violence against children that has taken on different forms. Now this afternoon we're going to be having a conversation about children, in particular children in alternative care setting that requires government and child protection officers, caregivers and child care institutions, which include those, to just raise public awareness about issues to do with children in alternative care. Now having this conversation, we're going to be taking a look at access to comprehensive child-friendly services during COVID-19 pandemic. I am joined by, we'll start with Miss Archer Rose. She is the Senior Probation and Welfare Officer in the Ministry of Gender, Labour and Social Development. She's one of the stakeholders we'll be having a conversation with. I am also joined by Miss Lillian Mpabulungi Sengova, who is the Deputy National Director, Head of Programs at the SOS Children's Village, Uganda. Welcome to NTV.
Thank you and good afternoon, listeners and viewers. Welcome to the show.
And we are also joined by SP Caroline Kushemerera, who is the Superintendent of Police, Child and Family Protection Officer within the Kampala Metropolitan Region. Welcome to NTV.
Thank you so much. Good afternoon, viewers, and welcome to the show.
And joining us online, we are joined by Ms. Dora Musimire, who is a Child Protection Specialist in Child Fund International Uganda Country Office. Welcome to the show, Dora.
Thank you. Good afternoon, viewers.
Now we'll get right into the conversation, and we're going to be starting it off with Lillian. When we talk about children actually in alternative care, what is that? For many it's a term that is new. You might be hearing it for the very first time. So let's start from there, Lillian. What is that term?
Yeah, thanks, Rita. When we're talking about alternative care or children in alternative care, we're basically referring to those children who are who are provided by care and caregivers that are not their biological parents. So this could be formal or informal. And this definition is actually coming from the UN guidelines, as Rose may input to it. And we look at different issues around alternative care. We're looking at all the care options in terms of kinship. Those children that are looked after by maybe a sister or a brother, maybe the brother passed on and they have to be looked after by somebody, a relative, basically. And then we're also looking at those who are being fostered, those that are formally taken over by law and being looked after by another guardian. And also at the same time, those that are adopted. And those that are into independent living, because we have those children that are probably around 15 or 15, 16, 18 to 18 years, that are living alone. So they are provided for, so they're in another form of alternative care.
Now it takes on different forms, as you have mentioned, but taking a look at where we stand as a country when it comes to alternative care for children in at this point in time, putting into consideration the COVID-19 pandemic and before the COVID-19 pandemic.
Okay. If we're looking at that right now, children in alternative care, we have different forms, as I said. And if we're looking at the children in residential care, like those in SOS, the ones that we support, we have the estimated number is over 40,000, according to the Ministry of Gender and Labour and Social Development. At the same time, we are looking at the children in kinship. Many of us, I believe, were either brought up by a relative or a friend. You spend time with a non-biological parent. And then we have those who are looked after by the foster parents in Uganda. So we have a combination of all, and there is adoption that was approved and within our Children's Act, Amendment Act 2016, that's provided for. So all those are children within alternative care. However, when we're looking at the statistics that we have, it's limited, it's scanty. Most of it has focused on the formal alternative care, and these are children within the residential care or the children's homes, as mostly known for most people. SOS, Sanyo Baby's Home, Zambia Baby's Home, we have a number of them that are being supported. And then we have those that are within foster care. Those numbers are known, and I'm sure Rose can provide more statistics on that, because right now the Ministry of Gender, Labour and Social Development has a tracking system. However, the bigger majority of the children that we have, of the population, especially the children within kinship, those with a relative, those numbers are missing. Nobody can put a hand or pure statistics to it. Even if you go to the Uganda Bureau of Statistics, that number is not there. So we have children that we have in Uganda that Ugandans gave birth to, but are actually missing in our statistics. And unfortunately, even when we do the census, most of the time the question is, how many biological children do you have? Now, the other that you're supporting, the dependents, that number goes missing. So what does this tell us? Maybe access to service becomes a challenge. And of course, we have other questions that we've been discussing with the Ministry of Gender, Labour Development and the police and the different stakeholders. Who takes care of these children? What is the quality of care? How do we ensure that the quality of care for these children in the different alternative care options is actually received well, is efficient and sufficient for the child of Uganda? When you talk to the child, it's totally different. You know, you have also this combination, biological versus non-biological.
And it goes back to how safe the child is in the areas that they are. But bringing you into the conversation, Rose, when she mentions that the fact, yes, there are some who are formally documented, but there are a number of children out there, not sure of the number, who are not actually a part of the system at the ministry. What do you have to say about that?
Thank you so much, Rita. I'll give an overall picture of the situation of children in our country. Generally, Uganda, we're a country that is having a young population. Most of our children, actually, we have a percentage, 56% of our children, of the population, being under the age of 18 years. Now, that's about 19 million children in Uganda. And this includes all those children in different settings, as I'll elaborate later on. And when you further analyze those statistics as given by UBOS during the Uganda Demographic and Health Survey, you find that those children that are under 15 years are about half of the total number of children that we have. And yet, we have issues that affect children in various categories, whether they're in alternative care, whether they're in families, or in whichever setting. When we look at the rights of the child, generally every child has a right, and the rights are categorized broadly in 4 main categories: survival, development, protection, and participation. So it is expected, it's our expectation that when a child is born, the child should be able to survive and develop to their full potential. Unfortunately, we are not, there are some deaths that happen. Again, when you go to statistics, we talk about child survival. We are looking at children under the age of 5. I can't say that we as a country have made tremendous progress over the last decade in terms of reducing the numbers of children that are dying. That is child mortality and infant mortality. I may cite the survey that was done in 2011. In 2011, the Uganda Demographic and Health Survey, the statistics showed that for every 1,000 live births, we had 90 deaths of children under 5 years. So that was a big number. But when you look at the statistics of 2016, same survey, the number reduced to 64 deaths for every 1,000 live births. And now when you go to infant mortality, children who do not reach their first birthday, they die before they reach 1 year. Again, those statistics show us that there has been an improvement. From 2011, we had 54 deaths, infant deaths, for every 1,000 live births. And then 2016, we had about 43 deaths. Now, we are not yet there, but at least we can say there's been some progress in terms of that right of the child to survive and develop to their full potential. Now, when we look at the other cardinal right of development, we are looking at the development of the child right from the time the child is born up to the time the child transits to adulthood. Now, when we look at that aspect, we say that the best place for the child to develop is really a family. Because in a family, there is support of an adult, there is nurturing care, there is communication, and those are things that tickle the mind of the child, the brain of the child to develop. And of course, during that time, that's early childhood care. That helps the child to transition to now primary school and eventually to secondary school. You remember that the government introduced the UPE, Universal Primary Education, in 1997, and then Universal Secondary Education in 2007. When those programs were introduced, there was massive enrollment. Enrollment of children in schools increased. However, our challenge is the completion rates. For example, our learners in primary school, statistics show that about 30% drop out of school. They don't complete up to P7 due to several challenges. And even those that are in school, we still have low levels of literacy and numeracy in our learners. So those are some of the challenges that we are still battling with, that we need to work on as government. And when we look at child care and protection, as I earlier said, it's one of the rights of the children, and every child has a right to be cared for, especially by the biological parent if possible. But we have situations where children are not able to be cared for by the parents, and therefore, because of the nature of our society these days, the issue of extended family is slowly fading away. And you know, these children find themselves in situations outside family care. That's why we have children in residential care facilities. Those children go there for need of care because there is no any other family member that is able to give them care. And we don't have the exact statistics, but we approximate about 40,000 to 50,000 are in residential care. Those are children's homes. And we still have a problem of children being on the streets. And even then, we don't have exact statistics. It is estimated that there are about 10,000 children on the streets of Uganda. So these are children that have fallen outside family care. And now, that's when alternative care comes in, especially for those that are in the children's home. We also have, as government, we have rehabilitation centers. We take them there, and with the hope of giving them the skills that they will go and live meaningful lives thereafter. Within the issue of child protection, we have various categories, of children that really are in dire need of protection. And generally, as a country, almost all our children are vulnerable. So we have other children in other categories, children who are in child labor. It's estimated that there are over like 2 million. We have issues like child marriages, trafficked children. So there are so many issues that we need to tackle as a government and also stakeholders. And lastly, the issue of participation is another right for children. Of course, every child has a right to freely express their views on matters that concern them, and those matters should be taken with serious interest and given due weight according to the age of the child. But you notice that in our society, because of the way our cultures are constructed, children are not allowed to take part in certain critical decision making that is very vital for their lives. So we still have challenges in that aspect.
Okay. Well, you mentioned things such as child labor and how a number of these children are actually not in the system. Yes, we have seen a number of children on the streets.
Yes.
Perhaps when you're on your way, you have seen pictures, you have run stories on NTV, and bringing in SP Caroline into the conversation. As the police, she mentions that children have a right to be protected. And I know that within the police, a number of these cases are brought to you. But getting back to tracking these children to see, well, this one has been in care of this particular person. As a stakeholder, how does that work for you?
Oh, thank you so much, Rita. We, as police, we work with different organizations, especially we work closely with the Office of the Probation and Social Welfare Officer. So in case there is any need or children that have come in contact with the police, we normally contact them. We do the tracing. We have also volunteers in different villages. We have the Secretary for Children Affairs. We work closely with them. And in case there is need to do the tracing, and for those children that have been in conflict with the law, we do it as a team. Yes.
Now, do you ever have a hard time? Because, you know, when we talk about monitoring of children in alternative care, you say you do the tracing. Is it usually a hard time trying to track down that, well, this child has been in this family, are they in the system? Is it known, well known? Is it just that people on the particular village or area know that, no, that child comes from that gate every single day? Do you ever have a hard time there?
No, not really. It is the biggest challenge, by the way. A child of a neighbor may not be known to the next neighbor. That is a challenge. And also, we have also found out that some of these children, by the time the child leaves the home, there is a reason. We have cases of those missing children. They have been on the increase. A child, you meet a child here in the city, the child tells you the child is going to either Gulu or maybe Mbali, and you wonder, the child is moving on foot, and you wonder why the child decided to leave the home, heading on foot in an area that he doesn't know even the route that is going there. So it is a big challenge. Sometimes it is, you may be able, but it takes time. At times they lie to you because of what happened at home. They are mistreated, they are beaten, they are tortured. Cases of torture have also gone up during this COVID-19 pandemic. Children have been burnt. So most of the times when we get them, they opt to go to relatives, other relatives. They either tell you the parents died, or they will always tell you that they don't know where they came from because they have been abused, and they will opt for another alternative. They can easily maybe lead you to a different alternative, but they will, most of the times, they don't want to reveal where they've come from because of the abuse that has, maybe a case in point was this girl of Kawala. I remember I saw that story on NTV several times. But that child disappeared for some months and again reappeared at Katwe police station, stayed there for like 3 weeks or 4. Until I asked her, I was like, isn't this the girl that was on NTV? But she gave them different names and totally different information. Maybe because of what could have been
happening at home.
Yes.
Well, bringing in Dora into the conversation, she's joining us via Zoom. You're a child protection specialist within the country, Dora. Could you paint a picture for us when you hear the gaps between the statistics, those that are formally within the system when the Ministry of Gender, Labour and Social Development, but also taking a look at that gap and what problems there lie within it?
I beg your pardon?
I was asking if you're a specialist, a child protection specialist within the country. Could you paint a picture for us when you hear the statistics of these are the particular ones that are actually within the system, but there's a number that is not? The problems that lie within that area.
Yes, rightly said, yes. And considering that right now we are in this COVID-19 pandemic period, the statistics are actually expected to go even higher because we have children now in the communities. Some parents have lost their jobs because of the lockdown that was partially lifted. So we'll see a lot of stress, and we don't have the concrete numbers. So this monitoring we are talking about is very, very critical. We need to look out for those numbers. All children need to be visible. We shouldn't leave any child behind. So that's why we are talking about monitoring, to start with community-based monitoring, because the children are living with us in the community. Before they get into residential care institutions, they are in the community. And who is in the community with them? It is all of us. It is you, it is I. It's the structures. The police rightly mentioned, they are right there doing diversion. So we need to start by keeping families together. Right now, we are all back to our homes. Most of these children are also facing a lot of stress. The stress is trickling down from the parents to the children. So there is a lot of likelihood that violence is happening. There is mental stress. So more and more children are likely to leave home, go on the streets. And these are the children we are talking about, children in need of alternative family-based care. So when we are talking about the big picture, can we start from the community, the structures, the local council, one, the community-based, the child protection systems in the community, the village health teams? Can we work jointly to trace for these children? When children are resettled from the residential care facilities, we need to look out for them. Are they still there, or have they gone back to those residential care facilities, or even taken up by other institutions? There is also a practice where children recurrently join different institutions. We need to trace for these children. And then we also need to look at kinship care. We need to go back to the African culture where a child belongs to all community members. We need to look out for those children, the orphaned children, the children who are coming from separated families, where a mother left, where a father abandoned those children, the child-headed homes. All those are numbers that need to be counted, that need to be visible in our programs, need to be visible in even the little program interventions being taken care of by a local council one, by a parasocial worker. We need to count those children. We need to see those children visible. And when we get to the residential care facility, are the children safe? Right now, COVID-19 has shut a lot of funding sources. Have children, childcare institutions sat down to reflect, to introspect, and re-strategize and modify the sources of income? Some children are with special needs. They have a broad range of disabilities, autism and the like. Some need specialized care. Where are we going to get these monies? The government is under-resourced. We have the social workforce, but vis-a-vis the funding to reach out to these children is very limiting. So that's why we're saying, let's work together. Let's do joint monitoring. Let's trace for these children. Let's keep families together. Let's get back to kinship care, to community concern. All of us are in this together. So that's the broader picture. Tracing for these children, making sure that children are visible, that we leave no child behind.
Okay.
Thank you.
Well, thank you, Dora. You do mention and you do bring in the society. Now, we are having a conversation about the access to comprehensive child-friendly services during COVID-19 pandemic, and you can be a part of it. Yes, it's an all-woman panel, but you're a gentleman out there and you are watching. You're also a part of this conversation when it comes to children in alternative care setting. We're going to be taking a short break, but when we return, we're now going to bring you in, the person at home. How can you be able to help the government? Dora has mentioned there are a few challenges here and there when it comes to resources. But what can you do? We'll be getting into that in just a bit. Thank you for staying with us on NTV as we take a look at access to comprehensive child-friendly services during the COVID-19 pandemic. Now, taking a look at these services and bringing you back into the conversation, Lillian, earlier on you mentioned that the number of those that are formally documented when it comes to children in alternative care, the numbers are not as many as they are of those that are informally out there. And you mentioned the issue to do with access to services. Where is the lack and what services are they actually accessing?
Yeah, thank you. One of the key things that we're trying to look at when you're looking at access to service, you're basically looking at the basic needs: clothing, shelter, education, love, which we rarely talk about, but the protection that the child needs. Now, if you don't have the numbers, it is very difficult for you to even plan. You know, how do you target? How do you make sure that these children actually have the quality care that you are looking at? Now, first of all, I would just like to thank the people or the caregivers that are looking after these children in alternative care, because it's very key for us. We are giving an opportunity to the children to realize their full potential, to have hope to live better. All over the country, the kin, the relatives, you've done a good job, which we really appreciate. However, one of the things that we always miss, if a child doesn't have a birth certificate, right now if I look at our education system, the first thing they ask you, you're getting a placement for your child, they ask, what is the birth certificate? So you need it. Now, some of our children in kinship don't even have a birth certificate. You reach to get health service, so they'll ask you, when was this child born? If you have a birth certificate and you even have an immunization card, it's possible. And I'm sure the government is moving forward on this, because I had through UNFPA and through UBOS, there's some work. And I'm sure the organizations like the child care institutions that are supporting children, it's mandatory for you to ensure that this child has at least a birth certificate, a starting point, so that even if this child gets lost and goes to the police, there's some document you can refer to. All said and done, so long as the child does not lie the name and can't be able to be traced or remembers the village. Now, if we are to have access to the services, the education, the health, the care in a home, as rightly said, we should start from the home where this child is. If the child is in kinship, do we know about this child? Do we know the name? Do we show interest in this child? Do we even immunize this child? Because we are aware that the Ministry of Health has a health management system, information system that exists, which can track. But more so, we have NIRA. We have NIRA that is supposed to register every child. Every child is supposed to have at least a national identification, which starts from the birth certificate. So that in case you are to access the services of government, the universal primary education, the secondary education, at least your birth certificate can let us know. Now, if we are talking about the care in a home, those days we used to hear Makakumi, the LC1 knows actually the numbers that are there. They know the biological and the non-biological. So we need those numbers to be monitored, but in a systematic manner. the line ministries should be linked, so that if I start with Ministry of Gender and they say we have statistics on alternative care through the social service workforce, then that number, if I'm number one as Lillian, that's the same number that is with police, that's the same number that is in NIRA, that's the same number, so that tracking is very easy. Fortunately now we have the ID for the adults. I know we started on registering the children in schools, where that number, the missing number, the children in alternative care can come in. So that I know Lillian doesn't have a parent, but we can reach. So we need a concerted effort. Those children are not registered or with birth certificates. I call upon all Ugandans, the caregivers, to ensure that at least this child can get a birth certificate, short term at the, at the sub-county. That is available there. Then it's very easy. The education information system takes track of these children. We need that number so that at the end of the day, they can have access to the service we are talking about. But at the same time, using our social workforce through the Ministry of Gender to monitor the children in the homes, because usually that's where the problem is. Domestic violence comes in. When domestic violence comes in, I'll definitely run to police. And the next thing, I don't want to go back home. I'll want to go to an alternative care option. I'll even lie about my parents that they never exist. So we need to start small, but get there slowly and surely. If we are tracking the children, we know that they are parasocial workers. Do they have the numbers? Do they know that child X is in this village? So that even as organizations that are coming to support, that are coming to supplement on the role that you have in the communities, we can ably know that we've reached 50 families, there are 50 children, 30 of them, there is a risk of losing parental care. So we end up putting up strong gatekeeping that this child should not leave home, because it's in the best interest that this child should grow up in a family setting. If not a family setting, it should be a family-like best setting, you know, a likeness to the family. One of the things that we've realized through our work, SOS and other CCI, child care institutions, is you find if you're in a kinship setting, as siblings, when you've lost your mother or father, especially sometimes, you know, either or the breadwinner, the family will divide you up. Rose go to auntie so and so, Lillian go to auntie so and so. Yet, in the best interest of this child, it would be very appropriate for this child to grow up with one aunt and the other support, so that they grow up as a family. But even at that level, we start dividing them up. So access to service becomes even a challenge. Even the auntie who would have loved to support will say, I have my own. And gone are the days, Rose has rightly put it, gone are the days when we used to so much care for our relatives in our own homes. We prefer supporting away from home. Those are the realities. Now, if we are supporting that child away from the home, are they capable of accessing the quality service that we are talking of? Can they go to school? Do they have access to water? Do they have access to the reading materials? Right now in COVID, we are talking about reading materials. But you find that the children in alternative care are actually even suffering more. Those in institutional care, because probably there is already a system, they have access. What about those in kinship? What about the other children that are vulnerable, at the risk of losing parental care? Do they even have the reading materials that they need? Can they go to hospital? Even when they're going to hospital, we have also to access to medical care. Who goes? Is it the biological first or the one in alternative care? And yet, if you agree as a caregiver, take on this child, the service should be the same, because you've agreed. It can never be equal, but it can be the same. Clothing, shelter, the initial, so that this, at the end of the day, you judge yourself and you say, yes, God gave me a purpose to live. I gave an opportunity to this child, not my biological, but I have the will and the passion to bring up this child so that they can have access. Of course, I must say here, that COVID has brought in a different ball game altogether. 2021, I don't know what the situation will be, because the number of children that are losing or at the risk of losing parental care is growing day by day because of psychosocial issues, tension, and all that goes around with it. But it's possible.
Okay.
We can make it 2 to 3, start at least 2 children in 5 children, at least to have that, and slowly we have a target. Maybe very soon Uganda will be a model country where I say children in alternative care have the best of the best.
Well, Rose, just to bring into the conversation, when she mentions the ideal, if we have a tracking system, what do you have to say about that?
Thank you so much, Rita. When we look at alternative care, just as Lillian has alluded to it, the most challenging statistics to get in the continuum of care is the kinship care. And this is because mainly of its nature. It's really an informal kind of care. And because if somebody dies and the relative, the uncle or auntie takes charge of the child, so somebody wonders, why would you want again to get more details about, I'm already taking care of the child, and that's okay. But other forms like foster care, we have district probation and welfare officers. Those records are kept there in the districts. The only gap that is there is that we have not, as a ministry, we have not yet, collected all that data into one pool. But when you go to the districts, they have a pool of foster parents, they have a pool of foster children, and those, of course, we talked about those in residential care. Those records are there.
Okay. Now, if to bring in when she mentions, if at all, you having all the different government bodies coming together and saying, if perhaps I'm looking for, say, Rita, police will be able to, they have that system. The police can say, could you be able to tell us, do you have the information about Rita? And they all have it. How is it working right now when it comes to the tracking?
Right now, what is happening is, I think we have systems as ministries. Ministry of Health has a system. We have a system as Ministry of Gender. And we may not be having an overall system that is responsible for all the records of the children, but we are going there because as a ministry, as I earlier said, one of the issues we have is that every child is almost vulnerable, and so we have come up with a policy, the National Child Policy of 2020, and this policy has all these stakeholders and a number of strategies. So we are moving there. But as of now, each ministry has their statistics. And we want to move to that step where we are able to track a child with one identity, maybe from NIRA, and we follow that child to conclusion.
Okay. Well, Caroline, how many times do you perhaps as the police interact with a number of children who maybe they have come out, they have been on their own, you have put them in, they have maybe gotten into a family, but you find that that child has also left that family and is back on the street? Do you ever have such issues? Of a child leaving a particular home, like you had mentioned, the child lives, say, Gulu, comes all the way to Kampala and gets to Kampala, somehow they come into your care, yes, and eventually maybe they're placed in a home. But this child goes back into the same system of they're back on the street. Does that usually happen?
Yes, that one usually happens. In fact, I wanted to bring you to the statistics from March to August.
Of this year?
Of this year.
Okay.
In fact, I was comparing them with the annual statistics. I'm talking about Kampala Central, Mukono, and Wakiso, where I supervise. I was looking at the cases of child desertion. Those are children that have been abandoned totally without any care. And the challenge with this is these are children, most of the times they are abandoned as babies. Even though this child had been registered somewhere in some hospital or with a birth certificate, it is hard for you to know that indeed this child was registered somewhere. These are children of days, a week, a month. So we had 254 cases of abandoned children from March to August. And those are the children that end up in child care institutions, because tracing is hard, even though sometimes, you know, mothers, immediately after birth, some of them get other effects, other frustrations. Maybe it was an unwanted pregnancy. Some of them, after like a week, they come back to normal and feel like maybe I should get my child back. There is a few number of those ones that normally come back and trace for their children. And they go through the process, already the files are there. Maybe in the end they are given back their children. But there are those children that are taken to the child care institutions, and up to now as we talk, they are still there because we could not trace for any of the relatives, not even the parents, because of the nature of the abandonment and the age. We even have children of 3 years that are brought to the police stations. And it is hard. You ask the child, where do you come from? From Kampala. Who is your mother? Mama this. You know the names they normally call it. So the child can, it is very hard to do the tracing, and those are the children that end up in the child care institutions. We also have children that leave their homes, and in the process of tracing for the other parents. Those are the missing children. We call them missing, maybe lost and found. We received 460 since March, and that is a big number. So I think Kampala being the central, you know, as long as a child is abused, what they think of, what comes first in their minds is to move to the other relative. Maybe possibly things could get better. But also the challenge we have with the missing children, some of them cannot trace, cannot even give any information of where they've come from, not because they don't want, but because they don't know. So also the same children end up in child care institutions. Sometimes we put announcements where we can, we liaise with, but it is very hard to trace for where a child has come from, especially when the child cannot give any information here in Kampala. And remember that at police stations, most of them don't have reception centers, so a child cannot stay longer at the police stations because he or she will not be able to get other services like food, like care, the love, you know. Police is somehow, that environment, children just get scared. So we don't really want to keep them for a long time at the police stations. So,
as you mentioned, the number is rising. Just to bring Dora in, she earlier mentioned that every stakeholder can be able to help when it comes to having access to comprehensive child-friendly services for these children, and in particular, children in alternative care. So Dora, just to you, when you mention the responsibility, we all have a role to play. Just expound on that. What can I do? Me who's watching from home.
Thank you so much. Yes, this responsibility is for everyone. It starts with the viewer seated in their sitting room, seated under the mango tree, listening in. You know, it starts with us being vigilant, having our child protection antenna quite high, looking out for a child, even if that child is not your biological child or directly under your care in your community. It starts with being accountable. The Children's Amendment Act 2016 gives all of us a duty to report violence cases, and that duty comes with all of us being vigilant. Aside from that, the government has a primary mandate to protect these children. These children are citizens of this country. They have inherent human rights to be protected from all forms of violence. So we need government to put funds. The Ministry of Gender has really done a lot with the development partners, largely financing this sector. But we need to see a deliberate action by Ministry of Finance to finance this sector such that all the stakeholders are empowered. The probation officers have done a lot to avert cases. The police has done a lot to divert cases that should have come into institutional care, that families that should have broken down. They have done counseling, but they are under-resourced. And stakeholders cannot do much without being empowered with funding. There is no way probation officer will go to an institution to support a caregiver, a social worker, if they are under-resourced. So we need funding. And in that funding, we need evidence. We need evidence that this is a problem and a critical one. So we need to look at going forward in COVID-19 intervention plans. We need to see local governments putting in some funds to support monitoring of these child protection services. We need to see police not sitting at the OC station at the desk, but going into the community to support that mother. When the mother wants to report, how far is the police? How far is the probation officer or the community development officer? That's the reality we are talking about. That yes, it is everyone's responsibility, but we need support from the primary mandated institution, the primary duty bearer, that is government, and of course civil society is complementing. And then we need all these stakeholders together. We need to come to a dialogue. We need the owners of these homes, the proprietors, we need them at a round table. We need community dialogues, the parents, the foster care parents, the fit parents, and then we also need to listen to the children. They have a voice. This is about the children. What do they have to say? If we are looking at the different care options, what are the children saying? Do they want to go to maybe their auntie? Probably that is the auntie who actually has been abusing them. So we need to listen to the children and look at them as active participants in this area. They are not passive. They are active in line with their age, and rightly said by the senior probation officer from Ministry of Gender, the children have a right to participate. So this is a chance to also highlight the children as key, not just beneficiaries, but as key participants, active participants in this area. We have, for instance, caregivers, children who have been living in care, in institutional care, and have become adults. Some are not yet actually adults, but are doing independent living. Can we support these children? So it is all of us together, working together, but with the leadership of government, and thankfully we have public-private partnership with government, which is a very good enabling environment to have discussions across the board. We have bilateral agencies like UNICEF, we have civil society organizations, we have SOS, Child Fund, and the rest. These structures actually there. The ministry working with the development partners have actually put across so many standard operating procedures, but this cannot support the community if we don't have resources. So really my call is that the enabling environment needs to be supporting the different stakeholders to make their contribution, such that when the mother, the father in the community wants to make a call, they have access to a booth, a phone booth. They can call the Uganda Child Helpline call center. They can go to court without fear. So that is how we need to work in a multi-sectoral approach and not leaving any stakeholder behind. And then we will make sure that every child has a loving home, every child grows up and becomes a capable, productive citizen of this country.
Well, thank you so much, Dora. You have had it that every child actually deserves a home, a loving home. But how do we monitor that alternative care? You have found it, you can do it as well. Now that is all the time we had to have a look at the access to comprehensive child-friendly services during the COVID-19 pandemic. Mentioned this afternoon is that the cases of a number of children having no home are only on the rise from what SP Caroline mentioned. There is a way you can help, and you have had it. That is all the time we had this afternoon for this particular conversation. We were joined on Zoom by Dora Musimire. She is a child protection specialist from Child Fund International Uganda Country Office. Thank you for joining us, Dora. Also joined by Lilian Sengova. She is the Deputy National Director and Head of Programs at the SOS Children's Village in Uganda. Thank you. And also we were joined from police by SP Caroline Kushamererwa. She is the Superintendent of Police Child and Family Protection Officer in Kampala Metropolitan, and Archer Rose, who is the Senior Probation and Welfare Officer at the Ministry of Gender, Labour and Social Development. Thank you so much for joining us, Rose. Have a good evening.
Thank you.